In this demonstration, I'm going to chart an existing patient visit for a routine wellness exam and PAP test. For this fairly routine encounter, I'll show you how you can chart the visit quickly and efficiently through the use of a single integrated platform. Here we see an email message received from a patient by your practice, indicating that she is due for her annual PAP. The patient has received this email as part of the Health Maintenance Alert System, which automatically reminds patients of important tests or procedures due based on the indices that you select. Here in the practice, you see an example of the Health Maintenance Reminder message indicating that this patient's due for her annual PAP exam. And right from this screen, we can select the test and order it for our patient. The patient is now at the office for her annual PAP. For this charting example, we're going to apply a global template for a PAP smear. Applying a global template will populate the note with your standard CPT and ICD-9 codes. Now let's view our note. Here you can see that the note is now basically complete. Going back to the note, we'll enter in our history of present illness. We move on to the gynecology history section. We see that the information here is already populated into our note based on the patient's previous encounter. In other words, the data is carried forward so you don't have to re-enter the information, but only update as necessary. Now we're going to update the patient's last menstrual period and last PAP. Under Review Systems, I'm going to note some fullness in the patient's right breast. Moving to the History and Habits tab. Here we see the medical condition of allergic rhinitis that was entered directly by the patient. By utilizing the patient portal system, the patient is able to add medical conditions, medications, etc. prior to the visit, saving time for both you and your staff members. You can now review the current conditions for meaningful use compliance, or add additional history if necessary. Again, on the exam page, your previous exam findings populate from the last encounter. You can add to the exam, clear fields, or move to the next section of the note. On the medications page, you can prescribe a medication for a patient and view currently prescribed medications and reconcile them. When we move to the Orders and Procedures page, we see the exam procedures were automatically populated based on the template we used in the beginning of the encounter, including the defaulted comments for each procedure. Additionally, when we perform this test, education information is automatically sent to the patient via email, or by clicking on the red icon, you can print a copy and hand it to the patient in the office. Finally, we just code our note. Again, in our Assessment and Plan page, our ICD-9 codes automatically populate our note, and we can just indicate when we would like our patient to follow up. Let's quickly view the claim for this patient. The ICD-9 and CPT codes that we show on our encounter note is automatically populated in the CMS 1500 form, as Waiting Room Solutions is a single platform system with complete integration. Now let's view our complete note. We now see our completed note with each section filled out. Finally, we sign our note and we are finished. The patient's laboratory results or slide images can be uploaded directly into their charts and viewed at any time. Waiting Room Solutions was designed with the sole purpose of improving your total practice efficiency. Charting, optimized office workflow, one-click integrated billing, patient workflow, practice marketing, and revenue evaluation, among many other things, to give you complete peace of mind and allowing you to achieve greater freedom within and outside of your practice. Please fill out the form on the side to see how Waiting Room Solutions can help you achieve your goals.